Hello, everyone. We will go ahead and get started momentarily. I see a bunch of people are kind of joining us. Thanks for taking the time out of your day to be here on the webinar with us. Again, we'll give it a few more seconds and then we will jump right in. Okay, let's go ahead and start. Excuse me. So to begin, I'd like to introduce myself. I'm Derek Kirby. I'll be the moderator for the webinar today. Thank you again for taking time out of your day to join us. We have a lot to talk about, not so much talk about, but a lot of stories and experiences to hear from. This is our second webinar in the series, and kind of, if I'm honest, it's my favorites because this is the one where we talk to actual students. We're gonna meet actual students who are in the program that you are currently considering. And I think that's really special because you can hear about their lives, how they're balancing their lives, how they're going through the program, and just everything they're kind of going through and what they're thinking now that they're in it, as opposed to maybe what they thought before they started it. It's a really unique perspective, and we really appreciate the students that will be joining and speaking with us today. But before we jump in, let me just kind of direct your attention to the screen, those important deadlines there. The priority deadline is coming up for enrollment into this fall 2023 cohort, May 1st, which is, what is that, 5 days? So very, very fast. And then the final deadline is just a month after that on June 1st. So be sure to keep those deadlines in mind if you are wanting to join us for the fall 2023 cohort, which begins in September. So let's move on to the next slide here. If I can get this to progress, perfect. So agenda, this is a little bit of what we're going to be talking about today. Like I mentioned, panel interview with current online students. We're going to give you the opportunity to ask your questions live at the end, but before we do so, we're gonna kind of toss some warm-up questions to the students and get to know them a little and get to know their experiences and how they've been progressing through the program and what they like about it and what makes it unique. And then Dr. Nazarino, who's the director of the program, she's going to kind of explain to us and talk to us in detail a little bit about the program, what makes it unique at Brown. And then application checklist, we'll kind of go through everything that is required for that and what exactly we mean by some of these requirements and how you can help get yourself prepared for that. And then the best part of the webinar is when you can ask your questions and get them answered live. So one thing, if you take a look at Zoom, there's a Q&A box. There's also, that's where you can ask your questions throughout the session. You don't have to wait till the very end. Just go ahead and keep asking those questions. We can answer them during the webinar. We can answer them at the end of the webinar, but just be sure to use that. And also, I kind of would think it would be interesting to know, especially since this is an online program, where everyone is from. The attendees who are on the call right now, if you don't mind just putting in the chat, maybe saying hi to everyone and saying where you're from. We kind of want to know who we're speaking to and where you are, whether it's in the country or out of the country. It's pretty exciting just to get to know each other in that way. So feel free to use the chat and say hello to all of us. Without further ado, though, let's jump in and meet our presenters. So first and foremost, we have Joey Townsend, who is from South Florida, and she's an industrial and organizational psychologist. So she's here with us today. Super excited to have her. Next, Amelia Walsh, who is from California. She's a member of the School of Public Health Graduate Student Council and co-chair of Internal Relations, online Master of Public Health representative. So really excited to have the two of them here and to hear their perspectives. Siam was also supposed to join us. Unfortunately, he fell ill and is not able to be on the call today. But he has done this for us in the past, and he's a great person to kind of reach out to and hear advice from. So if you do have any questions at all, feel free to reach out. We'll leave our contact information at the end. But we would love to just kind of assuage any challenges or concerns that you have. So these are our student presenters today. And then also on the call, we have Dr. Jennifer Nazarino, who is the inaugural Associate Director of the Online MPH program. And she is also the co-director of the Philippine Health Initiative for Research, Service, and Training. So really excited to have Dr. Nazarino on the call. We also have Dr. Nithya Ramesh, who's the program manager of the online MPH program. Dr. Ramesh, she's an alum of the in-person MPH program at Brown. She's a dentist by training and is responsible for overseeing the curriculum, student support, and logistics of the online MPH program. So these two ladies are great to have on the call. They're very involved in the program and involved with the students. So be sure to direct questions their way as well. And then last but certainly not least, Kim Pulowski, which is she's the Brown University enrollment coach. And Kim actually has a great career in enrollment coaching. I think it spans 13 or 14 years, very experienced in this realm, and particularly with graduate online students. So she is your go-to contact to help with those questions or challenges you may have with the admissions process and getting all those documents collected, what's needed for those documents. She'll go into a little bit more detail on all of that a little later in the presentation. So without further ado, let's move on to kind of getting to know the students we have on the call today. So we have a few warm-up questions. And first, I'm going to direct these to the students themselves, but then I kind of welcome Dr. Nazarino, Dr. Ramesh, Kim, if you also have thoughts just from what you've heard, your experiences, please share. We'd love to have kind of a conversation here. So let's move into the first question, which I think is kind of the biggest question of all, the choices out there. Why did you choose Brown's online Master of Public Health program? And I'll kind of just follow the line here. So Joey, we'll start with you, and then Amelia. So Joey, just kind of curious, what kind of led you to Brown?
Well, that's a great question to start off with. But first, I just want to acknowledge everyone on the line here. Thank you for taking the time. I'm sure everyone's really busy and has a lot of other things they could be doing. So I think this is awesome that we all made the opportunity to get together. So thanks for including me in that. So Derek, I think it comes down to, I don't know, probably four reasons why I chose the Brown online program specifically. I was looking for, living through the pandemic, as we all did. I developed a curiosity in public health, which I hadn't really thought about public health before that, admittedly. I'm an industrial organizational psychologist, as Derek mentioned. So kind of the going in assumptions are everyone's relatively healthy and certainly alive. And so I hadn't really, contemplated a lot of what now I understand to be public health. And I started just doing my own research, digging around, reading articles, watching programs on the internet and so forth. And I sort of developed a fascination with it and started using some of the concepts in the work I was doing in a broader HR context in my own business. And then I thought, you know what? I would like to get some actual learning and credentialing around this topic. It's super interesting, super useful. And I saw a real interplay, in particularly with the equity work that I was doing in HR in organizations to create more equitable workplaces. And so I saw an online advertisement for the what ended up being the first cohort of the Brown program. And I started looking into that. And, it was really important to me to commit my time and my effort into something that would be high quality learning, where I'd get to learn from the best and the brightest in the field, So that's the first thing, was high quality. Second reason was, if I was going to do this, I wanted it to offer some sort of pedigree or prestige factor as well. So that those two things combined, I think of as sort of the value equation of the time and the money. The third factor was, it had to be, accessible for me. I live in Florida. I spend part of my year in California. I work. I have my own business. I have hobbies. I have family. Just like all of us on the line. You all have other things you're doing as well, and so I had to work around that. It had to be a program that was workable in the context of my broader life, and I thought Brown offered that. And the fourth component for me was, I'm fairly entrepreneurial, so I wanted something that was flexible, that gave me structure and gave me content and gave me a community, but that wasn't so structured and so mandated that I felt like kind of oppressed by it. And so I really thought that the Brown online program was a nice way to satisfy all of those requirements that were important to me.
I appreciate all those. I think a lot of those can resonate with many on the call. So it's always curious to me, because there are options out there. This isn't like buying a cereal. This is a big life decision on which institution you're going to choose to help make this next step in your career. So it's interesting to kind of hear your thoughts on that. Amelia, what do you have to say?
Yeah, I mean, I have a very different but also very similar story to Joey's and why I chose Brown. So there are several reasons. I think when I look back on it, it kind of boils down to everything felt like it fell into place with Brown, and it didn't really do that with other institutions. So I'll kind of like go back a little bit and start with a little bit of my background. So when I went to undergrad, I started out in biomedical science, and with the thought that I wanted to go to med school, and that was the end goal, and that was the only path. And then about 3 years into my undergrad, that changed for me because of some personal, just some personal life things that happened that made me not really want to be in a hospital setting. And so I kind of reevaluated at that point in time whether I wanted to be in healthcare, which was very strange for me because I had wanted to be in healthcare my whole entire life. And so it was a very challenging time. But I had a faculty member who was my microbiology professor kind of guide me through that. So my career ended up taking kind of a turn into microbiology. And after I graduated from undergrad, I started work at my city government's municipal utility wastewater treatment lab, and was doing a lot of chemical microbiological processes. And so it was a great job, but it was missing that aspect of my career that I had wanted for a long time, which was health. I mean, looking back at it now and being through this program, I see that, wastewater and water treatment is an aspect of public health. But, at the time, I didn't think of it that way. And so at that point in time, I kind of reevaluated my career choices and found public health as a career path, which, I mean, through undergrad, I took classes that were public health, but I just never really thought of it. And so, after doing some research, found public health, and I was like, this seems perfect. So it just happened that at that moment in time, Brown was also advertising their new MPH online MPH program. And so that's what I mean by everything kind of fell into place. I also applied for other programs though too, because if I'm being honest, I didn't think I had what it took to get into Brown. But when I found out that I was accepted, some of the factors that kind of contributed to me picking Brown over other programs, definitely the prestige. I mean, it's Brown, but more so just the general aspects of the program. So It was targeted towards people who wanted a career change, and I really appreciated that because not all programs do that. A lot of other programs are like, you need to have all of this experience in public health, and that was intimidating to me because, like I said, I didn't think I had experience in public health. And then also online program. I had been an online student for a bit prior to this program, and so I felt the most comfortable with that. And also it allows for flexibility, like Joey was saying earlier. And then there's also, I kind of liked the idea that it was a new program. You know, like Joey was saying, we're not oppressed by this really hard structured system. There is an allowance for us to make contributions and kind of pave way and advocate for change in the program if it's needed. And I really appreciated that aspect. And then the last thing I would say is I liked the generalistic nature of the curriculum. Public health is such a diverse field. You can do so much with it. And if you have a specific concentration, you go towards that concentration. And I mean, I already did that in undergrad, and it didn't really work out so great for me. And so I liked the generalistic nature of the curriculum because I can apply it to different fields and learn about different fields and kind of find my path that I want. And other programs didn't really provide that, but Brown's Online MPH does. So yeah.
Wow, thank you. Really appreciate these perspectives. I think that's super interesting to hear about that. I'm curious, Dr. Nazarino, Dr. Ramesh, Kim, have you heard from students like why they ended up choosing the Brown Online MPH over other programs that are offered?
So I'll share quickly. I think a major strength of our program is that it's very interdisciplinary. Similar to what Amelia is saying, is that we really do a holistic review of all applications. Yes, I know, of course, we look at, GPA, we look at, those kind of quantitative numbers, but we also very much think about how's their work experience? What are they bringing to the class, the course, to their peers? What kind of conversations are that we could help build in these in the courses where they can learn from each other, they can network, and they could really just understand each other from different disciplines and realize that public health impacts them all in different ways. And I think that type of bringing the diversity of just different individuals from different places of work, different kinds of work experiences, whether it's 2 years to 15 years or 20 years, 30 years, also just coming from, we have students that have a clinical background, physicians, we have psychologists, we have folks that have a public health background, but also folks that are similar to Amelia that felt like, okay, I don't know if I really have this public health, expertise, but we want students like Amelia as well to join and be part of the public health workforce because we don't want to be siloed. If anything, the pandemic has showed us the need for more information around public health, both nationally and globally, and to break down those walls so that we can talk to each other about really the impact of public health. And so that's why I think this one of the major strengths is bringing in just an interdisciplinary group of students that can really come together, share ideas, bounce ideas off each other, but also have some really interesting discussions, maybe disagree sometimes, and that's okay too. That's okay too. It's like, let's have these really important conversations that impact people's lives. So I think that's a major strength of our program.
Yeah, I agree. And I again second what Amelia said about how this program was designed specifically for online students who are working. Because most of our content is accessible asynchronously. We encourage students to work through things on their own time. We don't make synchronous sessions or lectures mandatory. Everything is optional. So we really try to take into account that students lead busy lives and we try to work around their schedule.
And
Great.
I think, I'll just make a quick comment, Derek, but I think what I hear a lot is, of course, the prestige of Brown, the flexibility that several people have already addressed, but also just from my perspective, when people kind of step through the door, is the support that they get. So it really depends on the individual. Some people don't want any, and that's okay. That's totally fine if you know what you're doing and you go ahead and move through the application process yourself. That's great. But if you want help, if you need help, we're here for you. And I'm not the only enrollment coach. There's 2 other ladies. We work together really well. We're here to help support you. And I think a lot of people appreciate that kind of consistent communication, keeping track of their application progress, and just having somebody they can bounce some ideas off of or go to for some additional support. So that's just a little additional information I've heard.
Thank you. Really appreciate those insights. Let's move on to the next warm-up question we have here. Before we do, I see there's a lot of folks on the call they're using the Q&A feature. That's amazing. We're going to go ahead and, like I said, answer those questions during the webinar. I might bring up a few at the end, just so we all can enjoy the answer to it. But I know there's going to be a lot of questions. We can't get to all of them, so it is kind of nice to ask them during the webinar. We'll try to actually answer them during the webinar, but we'll bring some up at the end as well. So continue to use that feature. So on to the next question. And I think this is a big one. How do you maintain work, school, and life balance? Regardless of where you are in life, it's busy. And so introducing a master's program into the hustle can be somewhat daunting. And so I'm really curious to hear, Joey and Amelia, how you were able to balance that. So Joey, I'll begin with you again.
Sure, another great question, and one that comes up a lot in the program, as you can imagine. So my approach tends to be pretty structured, so this might not work for everybody. There's a lot of things that I'm not, but one thing I do bring to the party is discipline. So I tend to take a pretty disciplined, structured approach to how I manage my time. I've always been like that, so I kind of use the same framework for working the schoolwork into my routine. So the first thing is just clarity around the goal. Like, why am I doing this? I remind myself that probably at least weekly of what my goals are, because it's easy to get distracted otherwise around all the different things, all the different temptations that you could do, all the different rabbit holes you could go down, all of the different pressures to make it perfect, all the different clubs you can join, all the different options that are available that might be very appropriate for some, but wouldn't be appropriate for me, given what my goals are. My goals were clearly to get a mastery of the content, understand what the open issues and gaps are, develop a community, etc. So I have my list of goals and I revisit that periodically. It's the first thing I do to maintain balance. And then I create what I call a balanced scorecard. It's sort of a riff off of, if anyone's in, operations management or anything, and you're used to like a balanced scorecard approach to management, I do that. So I net out all the different aspects of my life in categories that need attention. Each week, it tends to be the same categories. So there's, a category around work, a category around family, a category around social things, a category around, my pet, who is important to me. My exercise is important to me. So all the different things that I need to make sure I do during a week. I tend to manage my time week by week, so I don't get spun up if on any particular hour, or any particular day, if I haven't done something. I make sure I'm managing it to the week to the best that I can. And within each of those different, categories of work, school, etc., I figure out what is the minimum that I need to do and what is my desired contribution in each of those. So for example, as it applies to the program, there are, assignments, as you would imagine, that we get every week. There's reading, there's videos, there's, class time, there are postings that we might do, or homework assignments, papers, whatever it is. And so I figure out sort of what minimally has to be done during the week so that I don't get behind, and then what I would really like to accomplish. And then what I do is, I know this is getting complicated, but it might work for somebody. I look at the empty space in my day. So you think about your commute, you think about time waiting in a doctor's office, you think about time, on the treadmill. I often will watch some of the videos while I'm running. So I try to combine time that's empty with, or available with some of the obligations for my schoolwork. And that really helps me integrate the schoolwork into my day and not feel like it's something extra or something I'm never going to be able to get to or a burden. So that's something that really works for me. I think the other aspect would be I'm big on routine. Again, that wouldn't work for everybody, but for me, I like to have a certain time that I typically in the morning, first thing I walk the dog for an hour, second thing I work out for an hour, then I do some schoolwork, and then I get into my regular work day and so forth. So I have like a little routine that I've netted out, and I try to stick to that.
Thank you. I think discipline is definitely key to that, and I can appreciate even mapping out your day. I do that even not being in a master's program. It's just very, I don't know, for me anyway, it's very helpful. So I can appreciate that you saying that. Amelia, what do you have to add?
Yeah, Joey, I think all of that is really great. And I think I might steal some of those tips and include them in my practice. Because for me, work, school, life balance is still very much a learning process. And I think even if you are the most accomplished, I think there's still room to grow and add and to your process. So I have, I think, 3 things that I keep in mind when I'm trying to work on balance in my life. And the first, very similar to Joey, is lots of planning. This is something I learned last semester. I wasn't super great with planning last semester. I mean, I was decent, but I put a lot on my plate. I joined the student council, I got married, I had to do schoolwork. It was just, I started research this semester, but I always put a lot on my plate. And so I think understanding maybe when you're putting a little too much on your plate is important also, but I'll get to that later. But I keep a little calendar. It's right here. It's blurred out, but I keep a little calendar that has important dates, you know, when assignments are due, all of that, and try to plan my time around when assignments need to be turned in, do them way beforehand so that I can limit my stress. Procrastination when I was an undergrad, I'm gonna be honest, was a very big thing for me. I procrastinated a lot. And so coming into the master's program, that was a big thing that I wanted to change. And it's been a process, but it's, for me, when I have a bunch of busy stuff happening in my life, it makes it easier when I have a structure in school. And so planning out, this assignment is due on Friday or whenever, do it on Monday and then review it throughout the week. That's helpful for me. I know that's not always how people work, but that's kind of what I do. And then I also plan self-care into my weekly plan, because I think the first semester I burnt myself out very quickly. And I think when you incorporate self-care into your plan, into your routine, that can help with burnout. So I would definitely recommend finding something, you know, if you like to exercise, if you like to draw, if you like to listen to music, find something that you enjoy and that de-stresses you, and incorporate that into your day somehow. Because it's really easy to think of all of the stuff that we have to do and all of the people that we need to help. You know, if you're a parent, if you're a worker, if you have just hobbies, you know, it's all of these things that we have to do for other people. Think about what you need to do for yourself too in that. And then the second thing is communication. Communication is really big with your professors. Life happens, things happen. And I think if you communicate with your professors, faculty about those big life things that are happening, it can take the stress away from school. You know, recently I had something pretty major happen in my family, and I talked to my professor, said, hey, I can't do this right now this week. I need to take a step back. And they were very great about that. I've had great experiences. When I got married last semester, my professors were great about it. And then also, I think Jen was talking about just the cohort and we come from all walks of life. Our cohort has really created a great sense of camaraderie. And it's truly amazing. I love our cohort. Joey can probably speak on this too. But talk to your peers if you need assistance with something. As a member of student council, I host study sessions every week. And because stuff happened, I said, I have to take a step back. I can't host study sessions for a couple weeks. And people jumped in and kind of said, we'll take it over for you. And that was really great also. And then lastly, I think awareness of your capabilities is really important. Know when you're able to do something, but also know when you're able to not do something and be okay with that. There's going to be some weeks where you're very overwhelmed. And I know that joining a master's program, coming to Brown, a lot of us are probably type A. We want to be able to be perfect and strive for perfection, but being okay with not being perfect or being okay with just doing the bare minimum sometimes is very important. And I know that sounds very weird, but in order to maintain a balance in your life, I think sometimes you need to know when to pull yourself back. So yeah, that's kind of how I go about work-school life balance. There are probably people who are better at it than me, but that's kind of what I do. So.
Wow. I just want to say, both Joey and Amelia, your answers have been very honest. I think this is such a great conversation. What you're saying, I think a lot of people can relate to. I just really appreciate the honesty when we're asking you these questions, because it can be, obviously master's degree can be very challenging. It can be very rewarding. It can be all kinds of things. That's the kind of the master, or the joy of this program, specifically this field. So I'm kind of curious, before we head to the last warm-up question, and then we get to the live questions, if anyone else, any of the other panelists have anything to say about this.
I'll just quickly say that this is an investment in you. So I do think that I am somebody that is a recovering people pleaser and say yes to everything. And I realized when I was going through graduate school that my family, my friends are just going to have to understand that this is something really important to me. I've invested time, finances, loans into my graduate career, and I've had to learn the word no often, and family and friends were going to have to understand that. And looking back, I'm really glad that I invested in myself. And half the time I didn't even I think Brown University, I remember when I first got into Brown as I got a postdoc and then became a faculty member. I'll be honest, my parents didn't even know. I mean, they knew about Ivies, but I'm from California, so they knew more about the UCs. And so when I told them that, yeah, I'm transitioning now to be a faculty member, I mean, it was worth it. The investment was worth it. And I was really proud of myself to be the first in my family to get to that level, in terms of being a faculty member and being a role model for my children, my two daughters. So I just want to stress that it is an investment in you. We understand that it is expensive. We understand that. We are competitive in terms of price point, but it's still, it's a financial investment, and we understand that, and we want to make sure it's worth it for you all. So just letting you know, we've all been there. We've been graduate students as well, and we're here to try to make this experience worth it.
Thank you. Really appreciate that input. I think this is a great conversation. So last but not least, the final question here, advice for students considering the online Masters of Public Health. We've kind of shared little sprinkles of advice throughout the discussion here, but this is our opportunity to kind of just voice out what not necessarily stuff you're doing now that works, but even what I think is helpful is maybe something you maybe overthought before the program, that where now you're like, oh my gosh, this is actually a lot easier. Or, oh my gosh, maybe I should have prepared a little bit more for this. I think that's helpful. What's that? What I wish I knew then, what I know now, like that kind of advice. So I'll kick over to you again, Joey.
Okay, well, we could write books on what I wish I knew now that I didn't know then, or whatever. So I think it's probably obvious. I mean, we're on camera here. So you know, I'm not a traditional student. I'm, you know, in my early 50s. And so one of the things that I was not worried about, but I would say moderately concerned about when I was thinking about applying was, you know, am I going to be the only 50-year-old in a class of, you know, 23, 24, 25-year-olds, which is fine, except for I didn't want to be like everyone's surrogate, you know, parent. I do mentor some young professionals. I learn a lot from them, but I didn't want to like stand out and be the only one and feel like I was a drag in the class, I guess. So I did, you know, ponder that when I was sending in my application, like, am I going to be laughed at because, you know, what is this, you know, instead of buying a fancy car, going back to school is a midlife crisis. And so, but I said, you know what, Brown is known for their inclusiveness and the value of diversity that others have spoken about, specifically around this online program. So I thought, you know what, if I'm going to fit in anywhere, it's going to be at Brown. And so I was glad, you know, once I got in the class, and I'm certainly not the only one that is has joined the class sort of mid-career or midlife. And looking for, you know, kind of career enrichment or career pivot. And so I feel right at home. And I think even if I was the only one that was, you know, maybe a different demographic in the age demographic, I have no doubt I would still feel at home because everyone is really welcoming. I would say, you know, all the my colleagues, as well as the faculty, the administration, et cetera. So I would say if you're worried about something like that, you know, you might think, am I going to be the only one, or is this going to be weird? I would say don't let that hold you back. I'm really glad I didn't let that stand in my way. So that's one thing. I didn't apply anywhere else. Amelia, I guess, was a little more prudent. I was, I guess, playing the graduate school equivalent of putting it all on black in roulette. And I was like, you know, I really want to go to Brown, so I'm going to apply. And if I get in, I'm going to go. And luckily I got in. But I would say if you're contemplating, should you send in your application or not, you know, there is a small financial commitment when you send, you know, when you apply, but it's, you know, it's worth it if you're seriously considering it. So I would say, don't let the deadline get ahead of you, or get behind you, I guess. Just do it. And then I would say, one of the things that I was glad I did was I did kind of a self-awareness exercise, if you will. So, and I do this every, you know, before each class as well. Like, you know, what do I think I'm going to need? What are the gaps that I'm sort of bringing into this? One of them for me, given, you know, my age, if we're honest, I'm not a digital native. And so I was really worried about the technology component because it's all online. And while I did have a fair amount of experience with online education, just from my work, that I ran a corporate university, so we had online learning. I am not really facile with, I didn't know what GitHub was, you know, I'm not facile with all the data transfer kinds of things with technology. And so that was something that I worried about. It is definitely not a concern for me at this point. It was a small little hump the first couple of weeks of biostats in the first semester, if I'm honest. Not the statistics part, but just navigating technology. I'm sure some of you are laughing at me, which is fine. But what I did was I identified that, I saw it was happening, and I found somebody who's an expert in technology to explain to me, forget about biostats, but just explain to me how you know, cloud computing works and where the data comes in and where it goes, because I was used to stick drives and floppy disks and so forth that you don't use anymore. And so that was super helpful to me to just identify what it was and then, you know, find a quick solution so I could, you know, not get behind in the class. I think identifying sort of what you bring to the table is helpful too, because I think, as Amelia mentioned as well, we collaborate a lot. And so there's often issues that come up in a class or questions or whatever that somebody based on their background understands a framework that might be useful or has dealt with something directly in their past that they can help with. And so there's different opportunities to help, you know, help a colleague out based on, you know, kind of what you're bringing to the party. And then I think the third thing that is helpful to think about and that I revisit periodically is how I want to engage with others. And so my schedule doesn't necessarily afford attending all of the group stuff. But what I do is there's a handful of folks, there's an emergency room MD, there's a ethical, I guess ethics law, she's a lawyer, but she practiced ethics law. There's an institutional banker, there's a writer. And so we kind of tend to hang out as a smaller group sometimes. And so figuring out like how I want to contribute and what I want to get from the community aspect has also been helpful too. So I would just throw that out.
Thank you. I think that's some great advice there. Hopefully everyone is jotting all of this jotting all of this down. I am as well. I'm not even in this program, but this is great life advice. So Amelia, what do you have to add?
Yeah, so I think what Joey mentioned about it, just apply, I think is very great advice. I was on, the other end of the spectrum, Joey, so this might make you feel better, where I thought I wasn't advanced enough, I guess. I heard that all of these, well-accomplished people were in this program, and I'm over there like, I'm a baby. I'm 20, I think I was 23 at the time when I got in, and I was just like, I have no experience. I have nothing to bring to the table. And the imposter syndrome was very real for me. Even when I was applying, like I said, I applied to other programs because I did not think I had what it took to get into an Ivy League program. And I mean, that's my own, my own mental health that I, have been working on. But I think, one of the biggest pieces of advice is, if this program feels right for you, don't let the prestige of the university, do not let, even the gravity of a graduate degree, because, master's programs are more difficult than undergrad. Don't let that, or even just the fear of rejection, dissuade you and prevent you from applying. If this feels right, just apply, because you might regret it later on if you don't. And then another piece of advice that I would have also is to, do your research to ensure that this is where you're meant to be. Talk to people. Jen is very accessible. I've talked to her many times, and she made me feel really great when I got in, and let me know, like, you're here because you're meant to be here. And that was very helpful to hear at the beginning of the program. And ask questions. And Kim is here as an enrollment advisor. Talk with her. Use the resources that Brown gives you, because they give you amazing resources. And when I was in undergrad, I never took advantage of the resources that I had. And I ended up being fine, but I think because I use the resources here at Brown, I have created my little community within my cohort. I'm better off for it. So yeah.
Well, that's great. Thank you. This is all really great advice. Not sure. I'm curious, Dr. Nazareno, Dr. Ramesh, if you've heard anything from students like, wow, I wish I would have known this, or something of that nature. Like they're surprised of how easy this is, or they're surprised of how much they've grown in or anything like that.
I don't think they would say it's easy. So I'll say
yeah, bad word, wrong word.
But I do think they were surprised by how collaborative they all are together as students and faculty working together with students. I do think it's just amazing to see the friendships that have developed in this program. I think the cohort has this motto of leave no one behind. And that's something that really touched me, and thought, wow, like, in a time where we're so uber competitive in this Ivy, here we find these group of professional master students coming together to support each other in so many different ways, not just academically, but in life related situations, and be there for each other. And it's beautiful to see that. And particularly since like they've connected from all around the country and all around the world. I mean, so we have students from right now 23 different states that, in this short, we've just been we're a new program, so this is our first year, but to attract, students from around the country has been wonderful to see students wanting to apply, not just from the East Coast, not from just for the West Coast, but from the South and from the North, like just feeling that this could be a program for them. And it's lovely to see that, and from 9 different countries as well, and to see students wanting to join us globally. And just, I think what we really try to focus on is flexibility. The most, if not all, the students are working professionals. And so they just really do need that time to know that synchronous sessions are optional, they are available, they are recorded, they are available for them, but it's not mandatory. But we do encourage students to attend. The program is mostly async, but we really want still it to be high touch. So that's why students have the opportunity to meet with their faculty member every week. So I think that's something to consider. There's other programs out there, but we really try to focus on being high touch.
And I just want to add, because I saw some questions in the Q&A about the cohort characteristics. So we have a lot of students. I think the average work experience is roughly around 10 years. We have a lot of people from clinical backgrounds. We have nurses, we have clinicians, dentists, dental assistants, dental hygienists, and we also have a good mix of people from tech backgrounds, finance backgrounds. So I think we have a really good mix of students in the program. And like Jen said, I think what is really amazing for me is how everyone sort of gotten together and help each other out. I have heard from students that they collaborate on Slack, they have WhatsApp groups, they have they do study group sessions where they meet with each other all the time. They're talking all the time. And we honestly did not expect so much collaboration in an online program. And this is something that has been really amazing to see how our students have got together and gotten so close. We have a core advisor, so our faculty serve as advisors, and they have advising meetings as well. So that's another opportunity for students to get to know each other and discuss their goals, not just with each other, but also with the faculty advisor.
Thank you. I think we are nearing the time now where we want to open it up to students. We'll be asking, or to participants, we'll be kind of asking your questions live here. A lot of them have been answered. So, and I apologize, I'm not super familiar with the Q&A. I'm not sure if you can see the answered questions. I can. I'm hoping that participants can as well. A lot of them have been answered, but again, we will be pulling them out, some of them out to be answered live. Before we open that up though, got a couple more things. We just wanted to talk specifically about the program. Dr. Nazareno will be kind of giving us a little bit more details about the program here.
Sure. So what makes our online MPH unique? We definitely implement case-based learning into each of our courses. Faculty implement various cases, public health related cases that are timely or that we can historically learn from, and that they integrate that into their curriculum. 100% online, like we have mentioned before, it's asynchronous. In order to provide more flexibility, we do have optional synchronous sessions weekly with a faculty member that can last about an hour, but we know that faculty, some of the faculty do stay for maybe even 90 minutes sometimes to just really answer questions or be with students and talk over problem sets or talk over case studies. In terms of curriculum, we do have 2 leadership courses that is unique to public health. Not all public health programs integrate leadership. We definitely do believe in the power of leadership and communication. So those are courses we offer. One of the leadership courses is taught by Professor Alex Glacier. She has her MPH from the School of Public Health, but also is an attorney, law professor, and she is focused on, she runs a nonprofit org focused on organ and blood donations. And she really brings in, and I think students really love this, is that she brings in her real life world experience, real world experience as the person that runs this organization into her course, right? And so I think people really love a faculty member that can really bring in real time, like how to be a leader, the struggles that she goes through, the challenges, but also the successes in running a nonprofit organization. The other leadership course is taught by Professor Karen Andes. She is a professor that is focused not just on leadership, but qualitative research, but a lot of her leadership and qualitative work has been in the global South, particularly in South America. So it's just, we really want to bring in these kind of different perspectives around leadership from the national level, at a nonprofit level, to somebody that has worked outside of the United States. In terms of competitive price tuition, $60K is the cost of $5,000 per class. We do offer scholarships, merit-based scholarships, between 33 to 50% scholarships.
Excellent. And then let's get into some of the things that are required for the application, and Kim can help us out with this.
Absolutely. Yeah, thank you. So right now we are using an application platform called SOFAS, and pretty much everybody that I speak to has heard of this in some form or fashion, but that is what we are currently using for our fall start date. And just to stress, down at the bottom of this particular slide, priority deadline, I know Derek has already mentioned it, but I'm going to stress it again. Priority deadline is May 1st. Final deadline is June 1st. And people may think they have a lot of time, but we're talking like 5 weeks max to get all of this done. So what you need as a prerequisite is, of course, a bachelor's degree. You need to have about 2 years of professional work experience prior to actually starting. And that needs to be reflected in your resume or CV, whichever option you choose to use. We do need 3 letters of recommendation, and those can be a combination of professional and academic. Or if you've been out of school for a while, like myself, I wouldn't even know who to ask, so you can use all professional. And as a matter of fact, in SOFAS, you can actually request up to 5 letters of recommendation, but Brown only needs 3. Your personal statement, and this should be somewhere between like 500 and 750, max 1,000 words. Committee is reading a lot of these, so you want to be considerate of their time. But this is where you really get a chance to kind of make a distinction for yourself. You want to show your passion for public health. You want to talk a little bit about what has drawn you into wanting a master's in public health. What do you plan to do with it? So talk a little bit about that. Why Brown? I know that both Joey and Amelia have done a phenomenal job of expressing why they chose Brown, but committee wants to hear why you're choosing Brown's MPH program over others, perhaps. Official transcripts. This is probably the biggest thing that trips people up in their application, and I'm not really sure why, but you need to actually have all official transcripts from anywhere that you've studied. So just keep that in mind, not your degree-bearing schools only. Let's see, there is an application fee in SOFAS. Both Brown and SOFAS offer some application fee waivers. And if you can't find those, please reach out to your enrollment coach. We have the links for that, so you can take a look and see if you would even qualify and submit your application for that. And then once you get your application submitted, the way it works is SOFAS goes through all of that. They will verify it. Once it's verified and all documents are on file, then we send applications to committee every Friday. And they are very quick. They will get a turnaround answer for you within 4 to 6 weeks, which is honestly very, very fast in this world. International students, you may need to submit a proof of language proficiency. Usually that boils down to the TOEFL or the IELTS exam. But again, if you have questions, please reach out to your enrollment coach. We can talk you through your own unique situation. And then the WES eval is also going to be required if you have studied overseas. So all of those things together, any guidance, any help that you need, myself, Kristen, Katie, we are all here to help you. Thanks, Derek.
That's perfect. Thanks for that information there. And next, I just want to do a quick little plug. We do have an upcoming webinar, another one on May 16th. I will go ahead and share the link for everyone to sign up for that in the chat if you wanted to go ahead. And that one is kind of, if you are having those lingering questions, regardless of where you are, even if you're just starting your research into Brown, or if you've been admitted and you're still kind of, I think it's totally normal, even if you're all the way down in the funnel and you're still kind of having those questions. This is a great webinar to kind of have those questions answered, specifically from Dr. Nazareno will be on the call. We'll have a few other folks on the call as well. Kim will be there, and we can really kind of answer those brass tacks of why Brown, why an online program, and why now. So please, if you're able to, go ahead and register for that. Now we'll move into the live Q&A. Before before I start with the questions, a few questions have come up about the spring cohort, spring 2024. So I just want to go ahead and answer that. That application will be live and open on May 1st. So you cannot apply for spring just yet. However, on May 1st, it will be available on the website. So be looking for that link on the website. And a difference for spring 2024 and the future enrollments, we will no longer be using Sophos. We'll be using a different application platform. Fall is completely normal. The fall 2023, everything is normal. Nothing has changed. Spring, which will go live on May 1st, that link will send you to a different platform other than Sophos. So just keep that in mind. If the deadlines are kind of tight for you, even though we'd love to see you on, in the fall cohort, if it's a little too tight to make, we'd love to see you in spring as well. So that opens on May 1st. Just wanted to put that out. And then one question, I wanted to kick things off really quick. And I know we are kind of at time, so we'll again look at the questions that have been answered, and if you have any questions, Kim and her team can help answer them. But I think one that really stood out to me that has to do with the students is how has the program impacted the work that you've been doing, and how have you grown so far because of the program? Joey, I see that you've kind of answered that, but I thought that was worthwhile, like bringing that up to both you, Joey, and Amelia. I think that would be a good perspective to hear from. So I'll toss it to Joey first, and then Amelia, I'd love to hear from you.
Yeah, so we are just 2 semesters into it, so still a lot to go. But I have found that the readings and just the topics that we are assigned, that we're reading about, and that we learn about from the faculty, as well as the learning I've experience from the community that all have very different backgrounds, as we're talking about, has given me some new lenses and some new frameworks, I would say, are the 2 biggest things that I've been able to incorporate in the consulting work that I do. I do HR and psychological and workplace psychological consulting, and those things have really been helpful in opening my eyes to some of the precursors to what's happening to employees before they get in the workplace. Right. And so it's been helpful so far.
Yeah. And then I can kind of jump off that a little bit. I feel like I've grown a lot since starting the program, definitely in my confidence within myself, but also within my personal knowledge of the world, and of myself. I mean, with classes, so one of the classes we're taking right now is policy, and I never would have thought that I would enjoy that class, because politics and public health policy was so foreign to me. But I have really enjoyed that class. I've enjoyed the lens that it gives me on various public health issues, and also that class lets you kind of explore an issue that you're interested in specifically, and that's been really fun because I've been able to kind of expand my research interest. I'm also doing a research project through an organization that's linked to Brown as part of my applied practice experience, and so I've been able to research something that is a very important public health topic, but is also very personal to me, and I've grown through that as well. And I think just having a community and that of people that are very that come from different backgrounds. I think that's very important just in general, but it has given me kind of an outlet to ask questions where I need to. And I have become a lot more willing to ask those questions and a lot more just comfortable being me because we are a very accepting group cohort, and Brown is very accepting. But I've also learned to kind of speak and advocate for myself and advocate for the people in my cohort. That's been something that I've really got a crash course this semester, but you know, so it's given me opportunities to grow in ways that I didn't think about before joining, and I never would have thought about before. So, you know, you never know what's gonna happen because each person is different. I mean, obviously Joey's experience is very different from my experience, and it's very different from the other people in our cohort. So
yeah, I appreciate that insight. I think that's a pretty unique way of looking at it, especially like how, yeah, you're going to experience it. You're going to have different challenges, different, you know, successes and whatnot. But I think what's important really in that cohort model that the two of you spoke about earlier is the support that's offered. And like, you can just talk to other people and they can tell you what they're going through and you can relate that to what you're going through. So I think that's important to remember, that you're all kind of shooting for the same end goal, regardless of kind of what's going on externally. One question I wanted to ask, so that's kind of what's going on now and how this program has impacted your life now. And maybe this question's more geared towards Dr. Nazarino, but there's a question about Brown University online MPH students, what they do post-graduation and some of the things you've heard students doing post-graduation.
That's a great question. So me and Nithya, you know, she has her MPH as well. So, I mean, folks can go into academia, but most of our MPH graduates, they either go into running a nonprofit organization or going into consulting or going into a hospital setting. Nithya, she got her MPH and she is a dentist by training, but she instead pivoted and no longer practices dentistry. I don't know if Nithya want to talk about that, like where after your MPH, you know, that just opened a different world for you in terms of opportunities.
Yeah, I switched over from clinical to MPH because I really like the world of my work in public health, where I could impact the community instead of just one patient at a time. So I really like being able to have that impact, and I never look back from there. I'm now also doing a doctoral program in dental public health. So I'm focusing more in dentistry in public health, but yes, so the MPH really opened up a whole new avenue for me.
And so my PhD was in medical sociology from UC San Francisco, and I loved it. I loved theoretical frameworks. I love thinking critically about various phenomena, but I think why public health is home to me is because it's very action oriented. I really wanted to be part of colleagues and students that could take apart certain public health challenges, but also not think about it very critically, but also come around and be like, let's think about interventions. Let's think about evaluations. How do we in real time make change? You know, and change can sometimes take, you know, we have to think about the long-term goals of change, but I wanted to be in those rooms. I wanted to be in those conversations. And so as it relates particularly to healthcare, it's just something that I grew up around. My parents were clinicians, but I wanted to be on that side where we're actually integrating programs. We're actually developing, building programs that provide prevention, intervention, and those got me excited. And then to also be innovative, right? And like think about, well, now we can reach each other and talk with each other online, virtually. How can we use that technology? How can we, you know, learn case studies that not just impact us here in the US, but other parts of the world? And how do we have those conversations with each other, right? And help solve some of our major timely public health challenges and get to converse and talk with each other about how it affects you. How did COVID impact you differently or the same? And how do, at the end of the day, do we come together to talk about solutions? And so that's what really brought me to public health and sustains me in public health.
Thank you. I appreciate that. Again, we're a little bit over time. We're getting so many questions though, and everyone's so engaged that I really hate to close the conversation. I think we all could talk about this for a while. I want to open it up to, the panelists here. Are there any questions that they've seen that they feel like they kind of want to give more attention to on the call? I don't want to miss something that maybe someone else feels like we should address. There was one in here that I thought was interesting. It asked the students what their favorite professor is. which professors are their favorite? I'm not gonna put anyone on the spot. I can say though that.
I
Oh, go
answered that
ahead.
one.
Go ahead. I was going to say, I was just typing an answer to this question. I can just kind of read what I was typing. I really enjoy, and Joey kind of mentioned this too, she really enjoyed biostats. And I really enjoyed biostats as well because I like quantitative data analysis and all of that stuff. But I get that that's not everybody's cup of tea. And Adam, the professor for that class, also understood that that is not everybody's skill set, and was really great about presenting the information that we needed to know in a very comprehensible way, and was very understanding and very helpful and very responsive to all of our concerns. So I really enjoyed that class, and I really enjoyed Adam. I also really enjoy, I've also talked about this a little bit, I enjoy policy because we get to Michael Harvey and Samantha Rosenthal. They have set it up in a way where we can kind of explore our interests in the field of public health. And I think that's really important for people who are just starting out. So I've enjoyed that class as well, and those two professors.
I will let them know.
And I've enjoyed biostats for sure. And I actually am really enjoying epidemiology because it's so different than things I've done before. And I like all the technical components of it.
This is great.
I will let them know too. Thank you.
Yeah. And I think just as a final word, thank you, Joey and Amelia. I think this has been really great. You've been very genuine, authentic, honest with your responses, which is very helpful. We all wish you the best and success in this program. And everyone on this that participated on this call, the attendees, we hope that you kind of felt that passion and that rewarding feeling of being in this program, doing something hard, but doing something that's really going to make you feel better about your life, about your career, about giving back. There's so much about the program, I think, that can really meet your needs regardless of where you are in your career or whichever industry. I have the privilege of working with these individuals at Brown on a regular basis with Dr. Ramesh, with Dr. Nazarino, everyone else who's involved in the program. And they're just a phenomenal bunch of people who really care about the students in the program. So thank you everyone for taking the time out and even spending extra time with us on this webinar. We really hope that we will see you this fall. And again, if not this fall, then maybe next spring. And if you do have any other questions, phone numbers there, emails there, talk to Kim, talk to her team, and we can get you going and hopefully see you at Brown. But thank you everyone for coming. Really appreciate it. Thank you.
Bye.